Hey, we're sitting here with Dr. Bilski and having a very interesting conversation. Dr. Bilski, of course, is a dentist, owns the Bilski Dental. And yet, you guys I know are doing facial aesthetics, and you're getting into that. So my question for you is like, so, what makes I'd be thinking like if I'm gonna have, lines taken out or jowls picked up or something, I'm headed to a plastic surgeon. Why would I go to a dentist?
Yeah, that's a great question, and we get that all the time. So when you come into our office and you see all these banners about microneedling and lasers and doing what we think we should be doing, and the reason why is this. A dentist is actually trained in head and neck anatomy.
Sure.
Face, and certainly inside the mouth, tongue, tonsils, roof of your mouth, anything inside there, and anything what's called perioral, which is basically anything outside the mouth. All right, so lips are part of that. Skin is part of that. We're supposed to do a head and neck examination when you come in. So any moles, any lumps, bumps, bruises, spider veins, dark things, we're supposed to be talking to you about.
You've already been doing this. It's to an extent.
So for 35 years, when I graduated, 35 years ago, that was what I was supposed to be doing.
It wasn't just the teeth even back then. It was just everything. Okay.
So we were looking for cancers.
Yeah.
Right. Is what it came down to. So the question was why a dentist and not just go to a plastic surgeon? The reason why a dentist would be good at this is because we'll train in it. Two, these are minimally invasive type procedures that a plastic surgeon doesn't have that much time in their own day for him or her to assess, consult, do the procedures, because they're doing body sculpting. And depending on the training, you can be a plastic surgeon that maybe only focuses on noses.
Right.
So they're not going to do the things that we're talking about. Can they do Botox? Yeah, they can do Botox. Can we do Botox? Dentists have been doing Botox
a long time anyway.
A long time. So TMJ, migraine, that kind of stuff. So utilizing it, it's just, I guess, the perspective of the community on who should be doing some things is kind of going away now. Would you want to go to a plastic surgeon to have your tooth removed or veneers? Probably not, because they're still not doing those procedures either. So you definitely want to go to a dentist that is considered good at it and has done enough of it.
Well, it kind of makes sense. You've been, as you say, you've been around here. You've already been trained to look for things.
Yeah, so
you already know how to work with folks and all that.
The minutia that we have to look at inside the mouth, and we're working with literally microns. Yeah. Then you move outside of the face. Now you can see it's a little more visible. Yeah. So what do you do? So just to give you some statistics, there's 6,000 plastic surgeons in the U.S. There's 250,000 dentists in the U.S. 10% of us do facial aesthetics or cosmetics. So we're working on the teeth, the lips, getting rid of fine lines and wrinkles, taking care of acne scarring. So that means there's 25,000 compared to the 6,000 of the plastic surgeons that just aren't doing these procedures anyway. Yeah. So I don't think we're stepping in anybody's territory or on their turf, because they're doing far greater things with the total body. They're focused on that. And as a dentist, highly involved with cosmetic dentistry.
Well, and there's a whole other, we've talked about this, and this is really another reason. Because, sometimes when folks have something done, it's like they don't want to admit, I went to a plastic surgeon. They want to keep that secret. You don't have to tell anybody you're going to a plastic surgeon. You're going to the dentist. That's
exactly right. So if you have some wrinkles and you got a forehead that's like a washboard, and you want that taken care of, then hey, where are you going today, Randy? Well, I got a dental appointment.
Right.
Yeah. What's going on? I don't know. Like, they're going to do some laser procedure, which you know fully what we're doing.
Yeah, sure.
And then you come back and they're like, how'd your appointment go? I'm fine. Just a little numb. No problem.
Yeah.
No problem.
And not only that, if you do go to a plastic surgeon, there's no way you can come back with a brighter smile. Now, if you have it done here, you might. If you want to get some teeth working your teeth done as well.
So, we were goofing around a little bit earlier. We're talking about making you look younger from the inside, your mouth out. Yeah. So we're able to do that with lasers and dentistry.
It's pretty neat. It's pretty. Well, I was going to say it's a unique thing, but as you say, there's a lot of dentists beginning to do this. This is not a crazy thing.
It is not crazy at all, and we're highly skilled and we're highly trained.
But I know you're really serious about moving forward with this in your practice. So that's. Yeah, we are. So if you head to the website BilskiDental.com, they can just make an appointment, come and see you guys. And I know you have a book. Maybe show it real quick.
It's. I didn't write this book. It's a book that has been developed so that it's an educational piece. You come in for your appointment, not obligation, no obligation, and we give this to you. And it has a bunch of QR codes,
So whatever procedure you might be thinking about getting done, you can go watch a video immediately about what's going to happen so you understand. So then the only thing left to do is say, hey, when can I do this?
Yeah, it's like, what are you looking for, Randy? I want to do this. I have acne scarring. Can I take it? Yeah, absolutely. This is what we do. It's going to take this amount of appointments. I expect these results. We'll leave it open-ended if you need more treatment. And then this is what it might cost.
Right.
Talk with Lindsay or Sophia at the front, and then we'll go from there.
It's kind of exciting. So, hey, head to the website right now. Again, that is bilskidental.com.